Everyone,
Caroline?
I'm I'm Caroline Wood. I'm the Associate Vice President of Student Services and Academic Support at the college, but I'm actually located right here in Warrenton and I live in Fauquier County. So the health of Fauquier County is very important to me. And we have some great news and really exciting things happening in terms of mental health at the college. So just as a little historical context, we used to not be allowed to offer counseling services by statute at the college. So none of the VCCS colleges in Virginia could offer counseling. And we knew mental health was a critical issue for us. And we've been begging and begging and begging. And so this past year, they now allow us to use a third-party vendor. So we can't offer the counseling, but we can contract with a third-party vendor. So the Virginia Community College system has contracted with an organization called Timely MD to offer telehealth services. And we just kicked it off this semester and we already have students signing up. So if I can share screen, I will go ahead and share a couple of slides so I can show you what we have. We had options as far as packages, and I really want to acknowledge that our president supported us when we came to ask for the biggest package because we wanted access to psychiatry, which we know is very hard to get and there could be long wait lists for. So we actually have not just counseling services, but psychiatry services as well. All right. So is everyone seeing my talk now? Is that what you see?
Yeah.
Excellent. Okay. So I'll go ahead and I'll skip through a couple because this is from so the first service that we're offering our students is a Talk Now, which is a 24/7 on-demand crisis hotline. So this is endless availability to students so they can use it over and over and over again as they need it 24 hours a day, 7 days a week. And then we've worked out a protocol with the provider in case there is the need to involve local authorities to do a well check or take a student to the hospital. So these are critically acute situations, but a student could call and say, I'm really stressed about this test, and the person on the other line will talk to them about that. And then they could also at that point set up counseling visits. So we have through our program 6 counseling visits per student, and any of our students can sign up for these. This is our workforce students or non-credit students and our credit students. Doesn't matter how many credits they're taking. They could be taking a 1 credit class or 21 credits. Everyone has access to these services. So all of the folks that are treating our students are licensed counselors. So they're not paraprofessionals, they're professionals, and they are licensed in Virginia. And they'll also offer some of licensed professionals that are licensed in Maryland and West Virginia as well for some of our folks who might live in other states. And so it can be done through phone, video, text, and students can choose their counselor and they can make schedules, and Timely MD has guaranteed us that students will be able to get in within a day or two. And so, as I mentioned before, we're really excited about the psychiatry piece as well. This offers us a couple of things that we did not have before. It allows us from our conduct and our threat assessment to be able to require psychiatric visits. So it'll help us really enforce safety and enforce mental health care if we believe it is interfering with a student's behavior on campus and in class. But it also allows us to refer students to a psychiatrist through Timely MD if they need to access medications, which they might not have been able to because they were uninsured or just couldn't get in with a psychiatrist. So what they don't do is they do not do controlled substances such as like a benzodiazepine, such as Xanax, or they don't do things that might be prescribed for ADHD. If someone is diagnosed with ADHD or anxiety and needing a benzodiazepine, they would work to get a local provider. But again, so no controlled substances are given through with a Timely MD psychiatrists. And so also students get a discounted prescription card. And so this is all free to students. So students do not need insurance. They do not even if they have insurance, it's still free to them. So they don't have to record it with their insurance. So if they only have a limited number of visits with their insurance, they can then use them elsewhere. Also, we have some health coaching available to students. So if students want to talk and meet with a coach about sleeping, nutrition, exercise, healthy eating. So we really want to encourage healthy behaviors to support overall physical and mental health. And those are unlimited visits that can be scheduled. And we've actually had, I was really happy to see when I looked at our numbers today before this call to see that students really are actually utilizing the health coaching. We've had several students utilizing it so far. So also they do discussion groups. So students can sign up for little seminars and discussion groups that might be happening online, like they'll do around finals for stress, also about suicide and suicidal ideation. And they also do yoga and meditation and other wellness activities through the app. And I will stop sharing screen. So again, so all of those are free to students, all students at the college. And after a student has maxed out their 6 visits, they will need to go into the community to use community resources. And what we feel like this does is in many ways it fills that gap in between when they can get services in the community and treat them acutely and immediately at the college. But we do know that for long-term care, what we will do in those 6 in between the time they get those 6 counseling sessions is get them securely into a local counselor's office and ready for long-term care. We are thrilled about this. We already have 30 students who have been using it, making appointments with counselors and doing the health coaching. Our faculty are thrilled because up until this point, we have had to refer students to local resources. Our local resources are wonderful, but we know students are not great about follow through if there's not immediate gratification in getting appointments. So we know students struggled a little bit to get appointments, and this is just really easy. Log onto the app and get an appointment. Any questions?
I'm excited you're doing that program. It's great to hear, Caroline.
Well, thank you. We're thrilled.
Caroline, are there other community colleges that are, doing this as well? Do you know of?
Yeah, Germanna is doing it. Nova and Germanna are doing it. I know Germanna is doing the psychiatric piece as well. I'm not sure that Nova is doing the psychiatric piece, but I do know that they're doing it as well. So there are 23 colleges, 20 are participating in some way or another. We do have the highest level of service with the psychiatric visits, though.
That's wonderful, and wonderful for, especially like RRCS to know, so that if they have someone who comes in who is a, Germanna or LFCC student, that those resources are available.
Absolutely.
Yes.
Yeah, you can ask them. And if they are, they can access those immediately.
That is fabulous. We are excited for you. Now, are the faculty and staff jealous?
Yeah, well, it's so funny. We presented to the faculty last week, and that was their first question. Well, are we allowed to do this? And I said, if you take a class, you can. But meanwhile, a lot of us through our employers have the EOP. I guess that doesn't sound as glamorous as Timely MD, even though it offers the same services.
All right. Any other questions for Caroline? Was it, it sounded like this all, you got approval and then it went gangbusters. Like,
yeah, there was a lot of built up need for it. So I think that, the colleges have really been pushing and pushing and pushing. And this is actually just an emergency contract because they have to put out a request for proposals. So we may not end up in the long run with Timely MD, but we will have a service. But so far, we've been very pleased with Timely MD.
That's wonderful. So other than that new sort of, putting it out to bid, are there any other challenges you foresee in the future?
I think that paying for it. But I will say, one of the things that we are able to pay for it for the cost of one position, really. And I think that if you look at the services you're getting, which is really a full cadre of counseling services, including psychiatric care, for the cost of one position for the entire student body is amazing, because we know, of course, every student's not going to take advantage of it. So it's a per student cost. So the paying for it we'll have to find the funds for it. I think